A state representative from Austin has filed a bill that proponents say would begin removing police officers from mental health emergency calls and transferring that responsibility to paramedics.
This effort comes after the recent conviction of Austin police officer Christopher Taylor, who shot and killed a man with a knife who was suffering a mental health episode. Senior reporter Tony Plahetsky joins us now with more. Tony?
Hey, Brian and Quita, State Representative Howard did not cite the shooting involving Officer Taylor as the driving force behind this bill. Instead, she said she is focused on the goal of making sure that those having a mental health break get the best help possible.
I think that this is a very positive first step in starting to remove law enforcement from being the primary responders when it comes to mental health calls.
Days after Austin police officer Christopher Taylor was convicted of deadly conduct and sentenced to 2 years in prison and the death of Morris Da Silva, Austin Police Union President Michael Bullock called for a policy shift in which officers would not respond to mental health calls. Austin police officials rejected the idea, but now an effort at the state capitol could diminish their role in certain circumstances. State Representative Donna Howard has filed House Bill 1656 that would give authority to paramedics to seek emergency detentions for a person suffering mental illness and posing an imminent threat to themselves or someone else.
The paramedics oftentimes already have a relationship with those in their communities who have mental health issues.
Right now in Texas, only police officers have the ability to detain someone without a warrant in a mental health crisis. So police are frequently and inevitably called for such emergencies. Under the proposed legislation, a paramedic who detains a person must take them to the nearest appropriate inpatient mental health facility or a mental health facility deemed suitable by the mental health authority. They must also file a notice of detention about why they believe a person should be held. Howard says police officers may still play a role, but
they shouldn't be the people that are there to provide the bulk of that intervention, because that's not their expertise, and they shouldn't have to be the ones doing that.
Bullock says a move toward paramedics would allow police to prioritize their primary mission of public safety.
My position is that law enforcement shouldn't be the primary responders, and we shouldn't be the ones that bear the responsibility of solving a mental health crisis when we are not the experts, and we've never claimed to be.
So it's early, but this effort appears to be gaining support from both law enforcement and the paramedic community. Representative Howard says the State Sheriff's Association, they're the ones who first approached her about this idea. We also reached out to the president of the Austin EMS Employees Association, who agreed that medics have more advanced training than police and how to handle these types of calls.